Hello and welcome everyone to Women's Health Tech Wednesdays. I am your host, Nina Joshi. Have a couple of quick announcements before we bring on our guest for today. We also have our Breakthrough Alliance applications that are open up until the end of October, so still some time to get those applications submitted. And we also have our Women's Health Tech Challenge and apps are open for that until September 3rd. So that's also kind of a deadline that's fast approaching. So make sure that you submit for that challenge as well. And with that, we'd like to formally introduce our guest for today, Dr. Arij Faksh, who is a maternal fetal medicine physician at Scripps. Hi, Dr. Arij. Thanks so much for being here.
Thank you so much, Nina, for the kind introduction and the opportunity and invitation to speak here today at Women's Health Tech Wednesday. I must say, I am just so encouraged as a mother, as a clinician, as a researcher, as a patient advocate about all the incredible work that you're doing here at HIT Lab, and really excited to be here and share with you a little bit about what I do as a maternal fetal medicine specialist and how we can kind of partner together to elevate and improve women's care.
100%. Thank you so much for those kind words. It's really guests like you that, that make these events so meaningful and exciting. And we're just so excited to have the opportunity to learn a little bit more about you and all of the amazing work that you're doing. And I think maybe a great place to start would be if you could share a little bit more kind of about your career journey. What inspired you to specialize in maternal fetal medicine and, a little bit more about your training and kind of your journey so far.
No, absolutely. So I currently practice as a maternal fetal medicine specialist. So I'm a double board certified physician specializing in obstetrics and gynecology, as well as maternal fetal medicine. And I practice in a variety of clinical environments. I'm currently a full-time physician seeing patients at Scripps Clinic in San Diego. I also am a consultant at two local federally qualified health centers where I serve underserved populations. One of which is La Maestra Community Health Centers. The other is San Ysidro Health Centers in San Diego as well. I'm also co-founder of a clinical research company called A&B Clinical Research in San Diego. And really the premise of our clinical research company is really to extend and really improve access to high quality research for all populations to increase heterogeneity in clinical research trials, specifically related to women's health. So that's a little bit about what I do. I did my training at Maine Medical Center for residency, 4 years of OBGYN residency. And from there, I went to fellowship at Mayo Clinic in Rochester, Minnesota, and then landed my first job in sunny San Diego. My path to becoming a physician was somewhat unique in that when I graduated from college, I was really torn between, do I pursue a career as a teacher or do I go into medicine? So I actually became a high school teacher after college. I taught public high school chemistry up in rural Maine. And within my first, month of teaching, one of my students, one of my 11th graders, approached me and wanted to talk to me after school. And I thought it was about an upcoming quiz or test or question about the homework assignment. However, she disclosed to me that she was pregnant and she didn't feel comfortable speaking to anyone else because this was a really, really small, tight-knit community. Everyone knew one another, people talked, and I was kind of the outsider from kind of the bigger city. And then just being there and being a safe person, she opened up to me. Nothing prepared me for kind of how to counsel her or what to do or what advice to give her. So I just got the phone book, opened up the yellow pages. We called Planned Parenthood together and she made an appointment. So it was in that moment that I realized I really want to help women and I want to empower women to make decisions. And that event really inspired me to take it to the next level and really immerse myself in women's health, start shadowing doctors, and ultimately pursue my career as an OBGYN.
What a beautiful story. That is incredible. And I think really just speaks to the calling it seems like that you really kind of had towards medicine and the work that you're doing. Thank you so much for sharing that. That's amazing. I wanted to ask, I mean, that already, you hadn't even started medicine yet, and that is such like a rewarding experience. Wanted to ask, like, what are some other kind of high points, some of the more rewarding moments in your career that you've had as a maternal fetal medicine specialist?
Oh my gosh, there's so many. I feel like in what we do, the highs are really high and the lows are really low. There's just
Mm,
so many rewarding experiences, so many challenging experiences. And we have a really unique blend as a maternal fetal medicine specialist because we delve with a little bit of internal medicine into some critical care, into some radiology, into some neonatology. And I find this very intellectually stimulating. I think the most rewarding part of what I do is really partnering with my patient, her family, and the entire medical team to help a patient navigate a complex pregnancy to achieve the best possible outcome for herself and her baby. One
mhm.
particular kind of recent event that stands up in my mind was a patient of mine now 2 years back. I was seeing her for something called a first trimester ultrasound. And first trimester ultrasound is really our first glimpse into the baby's anatomy and health. Typically, it's done between 12 weeks and 13 weeks and 6 days, that detailed first trimester anatomy ultrasound, where we really look head to toe at the baby. And during
Mhm.
this ultrasound, we can screen for various fetal abnormalities, one of which is spina bifida or a neural tube defect. And we detected a neural tube defect in this patient at around 13 weeks of gestation. So we were able to counsel her on all the different options and follow her through her pregnancy. And this patient opted to pursue fetal surgery. So this is a condition where you can actually offer in utero intervention to treat and address and operate on the spina bifida while the baby is still inside the womb.
Oh,
This
wow.
procedure is highly specialized, performed by fetal surgeons who go for extra training beyond maternal fetal medicine. And I had the opportunity to follow my patient from San Diego to Texas to actually watch the procedure and be there for her.
That's
And
amazing.
it was such an incredible moment to be able to see my patient through and through, end up being part of her delivery, following her baby's journey. Her baby's now walking, doesn't have any issues with the brain, no shunt. So that's kind of an example of just really partnering with the patient, providing her all of her options, helping connect her to higher levels of care when indicated. And ultimately, every patient has different outcomes, but this was a very successful outcome and a story I'll never forget.
That's amazing. I think the fact that you not only were able to like counsel her, but just be a part of that experience and kind of like share that experience with her too, sounds so like inspiring.
Yeah, that personalized support really means a lot because there's no one size fits all approach to high risk pregnancy management. What I
Definitely.
love about my organization at Scripps is that our team really gets to know our patients at a deeper personal level and create these individualized care plans based on each patient's unique kind of goals and needs. Because every patient has different circumstances, and it's really important to delve into potential barriers to care, social determinants of health, and really, we really strive to provide equitable care for all of our patient populations.
I love that. And I think that's so powerful, especially because I think there's, when you think about pregnancy, there's so much context around it being like this joyful, beautiful moment, which it definitely is, but it's also, very scary and it's a very vulnerable moment for a lot of patients. So to be able to have like that individual touch where they still feel heard and supported, I think is really, really important. So it's amazing that, you and not only you, but your team, it seems like there's a
Mhm.
nice culture that really supports that.
No, thank you.
I love. And it's so crazy to me, Dr. Aish, because when you're not doing that, you're also doing all of this other amazing work, consulting, being a co-founder, all of that. How do you balance all of these various roles, the various hats that you play kind of in this space? Do you have any, specific philosophies or frameworks or tips and tricks for the rest of us?
Yeah. I mean, if you have kind of the answer to that question, I'd love to hear from everybody because I think honestly it's a struggle. It really is to really juggle it all. I think what fuels me is really my passion and my desire to make a difference. And I think what I've learned along the way is that you can't do it alone. So it's really important to have a strong team. and a strong network of collaborators. So I'm so fortunate to have my family close by supporting me with my son and our family. I'm really grateful to the team at Scripps who supports me and my goals in terms of integrating research into what I do, kind of working towards integrating my desire to kind of help other populations through the work I'm doing with the federally qualified health centers. And then with research, we've actually integrated our research into one of the FQHCs. So we're able to our clinical research coordinator actually goes to La Maestra once a week and is able to on site provide opportunities for patients to enroll in our research studies.
Wow.
So we created a business associates agreement to be able to do that because it's hard for women sometimes to have transportation to get to visits. So we're
Mhm.
trying to bring research to patients and really trying to increase heterogeneity amongst our research trials. Right now, we're conducting a trial looking at an innovative way to do non-invasive prenatal screening. And
Wow.
non-invasive prenatal screening typically is blood work where you can analyze the fetal DNA in the maternal bloodstream, so non-invasive testing, and it can provide a risk assessment for things like trisomy 13 or Down syndrome, trisomy 13, trisomy 18, or other conditions. But the company we're partnering with is looking for more innovative ways to do the NIPT via different like PCR-based technology to potentially get results sooner, faster, and at earlier gestations. So we were able to collect blood work from patients. We previously performed an STI screening study with a company looking at self-swabbing for STIs and looking at the efficacy of that. We also conduct
Mhm.
research related to fibroids and endometriosis. So really like women's health conditions and really trying to kind of integrate different populations into our clinical research.
That is incredible. I was just going to ask you, like, tell us more about some of the things that you're working on. That is amazing. And I love that you're really kind of thinking and tackling kind of like the full spectrum of women's health more broadly. And, would love to learn a little bit more about your more recent study with like the scans. When it comes to like, I would say fetal imaging, or I think imaging more broadly. I mean, you hear about so many incredible like advancements in that type of technology. Would love if you could share where like what are you seeing kind of in this space? And I don't know if there's any early just insights or thoughts that you could share around, what that process typically is and kind of the areas of opportunity that you see for that too.
Yeah. So that's some background about what we do day to day as a maternal fetal medicine. I think what I really love about what we do is the variety. So for
Mhm.
instance, we do a lot of ultrasound, like prenatal imaging, diagnosing potentially abnormalities or related to the placenta, related to the baby, related to the maternal uterus. We also do consultations. We do consultations during pregnancy. We also do preconception consultations before pregnancy to make sure a mother is healthy before getting pregnant.
Right.
This is especially important since we're seeing a rise in comorbidities amongst women. We're seeing women get pregnant older. We're seeing more hypertension, more diabetes, more obesity. We're seeing more women get pregnant with pre-existing mental health conditions and really trying to elucidate and mitigate potential risks to improve outcomes for both mother and baby. We do inpatient consultations, we do surgeries, we do cesarean sections, vaginal deliveries, we do prenatal diagnosis like amniocentesis or chorionic villus sampling, where we do diagnostic testing to figure out the genetics more thoroughly. I believe what I'm most passionate about, I love all of it, but I really, really, really love imaging and I love ultrasound. It's a huge area of interest. I actually serve as director of ultrasound at Scripps Perinatology.
Oh,
I'm
wow.
honestly in complete awe of all of the exciting advances in the technology with our imaging equipment, which really allow us to make more accurate and precise diagnoses sooner. I feel incredibly fortunate to work at Scripps because our organization has invested in the state-of-the-art ultrasound equipment, and we have very sophisticated imaging reporting programs, and we have a commitment to sonographer and physician education that enables our team to really provide the best possible information to our patients and our referring clinicians. Our imaging unit is accredited by the American Institute of Ultrasound and Medicine, and we perform a wide variety of ultrasounds, ranging from dating and viability ultrasounds to determine a patient's due date, So that detailed first trimester ultrasound that I was describing earlier, where we're able to really detect potential abnormalities as early as the first trimester. The second trimester, classic 19 to 20 week anatomy. We do follow-up growth scans. We also look at the cervical length to screen for preterm labor or patients at risk for preterm labor. We do fetal echoes to look very detailed at the baby's heart. And we do other advanced imaging techniques as well. We offer 2D, 3D, and 4D ultrasound, and there have been incredible improvements over the last years in terms of the speed of ultrasound, efficiency, clarity, resolution, and image optimization that have really improved our workflows and our ability to more efficiently screen for birth defects and provide more confident diagnoses. That being said, we don't always have all the answers, and we're very honest with our patients, very transparent about what we see and what we don't see. So we really try to provide realistic kind of appraisal of kind of the health of the baby. We're the first to kind of facilitate second opinion consultations if necessary, send patients to higher levels of care. But our ultrasound is really our lens, our window into the health and development of the baby. So we're really, it's very integral to what we do on a day-to-day basis.
That's amazing. And when you were kind of talking about some of the scans that are available, I was like, wow, I didn't even know that was a thing that you can test for. So it is so amazing to see like really the window into the health of both mom and baby.
Yeah, I also wanted to highlight additional work that I'm doing in the imaging space. I am working alongside a few companies that are looking at artificial intelligence and integration of AI into ultrasound to further complement what we're doing. I mean, we'll never replace sonographers or physicians, but using AI can potentially enable us to more efficiently perform our scans, more accurately perform measurements, and also help potential practices that don't have as many resources to more effectively kind of figure out which patients might need higher level of care, which patients may need like MFM sooner. So I'm really excited to work alongside others in this space with respect to elevating imaging and improving what we're doing and integrating other technologies to kind of take better care of our patients, because that's what it's all about, is really kind of uniting to leverage the different technologies to make a difference.
That is incredible. I love that. And it's so interesting because you had mentioned something a little bit earlier around kind of just like what you're seeing now with a lot of the comorbidities and kind of the mental health kind of going into it. And it's funny because I, obviously, on a very, very high level, have also seen stats around like gestational diabetes and like preeclampsia rates. I'm so curious from kind of the snapshot of like 2024 pregnancies and beyond, kind of with this new norm, has that like do you see it significantly impacting like just the way medicine is delivered? Or because I would imagine if anything, maybe a bit more like diagnostic things up front. I'm just so curious to see like will things kind of change a lot as a result of just, the new norm or the new paradigm in which women are getting pregnant or people are getting pregnant?
Yeah, that's a really, really good question, Nina. Thank you for asking it. Again, like our population is getting sicker. Where I feel like our focus a lot is on disease and not health. And I feel very strongly that women struggle with access. I mean, we have a lot of maternity care deserts. For instance, hospitals are closing, women have nowhere to go. And it's very much a struggle. Diabetes is on the rise, hypertension is on the rise, obesity is on the rise. 1 in 5 women are affected with a mental health condition.
Wow.
Another area of focus is the fourth trimester. Fourth trimester, typically we think of 3 trimesters, the first, second, third, but now there's an emphasis on the fourth trimester, which is a time after delivery. In fact, in the fourth trimester, over 50% of maternal deaths per the CDC happen after pregnancy. So within 7 days to 1 year after delivery. And these are preventable deaths. So I think a huge focus of mine is really the fourth trimester, because a lot of these chronic health conditions like the hypertension, diabetes, obesity, mental health, they don't go away after pregnancy.
Right.
And oftentimes after pregnancy, women don't have insurance and they lose the opportunity to transition to a primary care specialist. So how can we promote transitions of care to improve health throughout someone's life? is a huge focus of mine and something that's very important. So in our program, we partner with primary care doctors, family medicine to try to have those warm handoffs. So we're able to, follow women and continue treating them for those chronic health conditions, even beyond the pregnancy.
That's incredible. And I think on that front too, I think, really speaking to this incredible partnership that's forged and also so necessary. I think, there's definitely from a patient perspective can be a lot of that sentiment around like the trickiness when it comes to coordination of care and navigating care. And I would imagine in your role, you're not only working with a very diverse kind of, provider team of various specialties, but also a family, right? I think in some of these cases, the patient isn't just a patient of one, it's their circle, their network as well. So how do you kind of inspire or like ensure the collaboration and the partnership between, I would imagine, all of these various different parties involved?
Yes. Yeah, I mean, it really it's a team, it's a collaborative approach. We do have at Scripps a complex care management team, so a dedicated group of nurses that assists our patients with clinical care navigation. So that way we can kind of reduce patient stress and facilitate that seamless connection and coordination between a primary and referring clinician and other potential maternal or neonatal subspecialists. We also have established programs, like for instance, we have a diabetes and pregnancy program. We also have a Scripps Pregnancy Heart Center where we have established specialists that are not afraid of pregnancy, but excited about pregnancy and partnering with us to kind of facilitate that collaborative care model and bridge gaps between kind of what's happening in the clinic, what's happening in the hospital, and making sure the patient has like ongoing care.
That is incredible. That's amazing. And I think one of the things too, on that note, kind of thinking of like how there's so many like specific programs and things that are really kind of catered to all of the various, flavors of pregnancy and beyond. Can you share a little bit more about the work that you're doing kind of in the community space as well? I know you're working with like the federally qualified health centers
Mhm.
to really be able to provide care, maybe for communities that don't typically have access to things like that. Would love if you could share, some of the work that you're doing and some of the barriers that you're seeing that, do impact a lot of these communities. I think could be so interesting.
No, yeah, absolutely. I think one of the most exciting kind of areas that is something that really I think is important for all physicians is really mentorship. And I'm part
Mhm.
of the CalMed Scholars Mentorship Program. So I mentor community college students or students that are interested in pursuing careers in medicine who may not have the same level of resources as others. So I have students that shadow me in clinic. We mentor, have mentorship visits weekly, and this is a longitudinal mentorship curriculum.
Mhm.
So I'm able to expose them to what I do as a physician day to day, be able to connect them with other specialists they're interested in, potentially include them in research projects. And I feel like that mentorship is so critical because we wouldn't be where we are today without mentors and without collaboration and partnerships and really inspiring that next generation of physicians. So mentorship and teaching, and it goes back to when I was a teacher and, so much of what you do as a doctor is teach and educate ourselves, our colleagues, our patients. So it really kind of comes full circle with the education piece.
Absolutely. And honestly, speaking of education, and it's so true. I love that, this was your life. This was your role too as a teacher. So it's amazing to kind of see you be able to like play into that as well. But I'm so curious because I feel like pregnancy, the maternity journey can be such like a new space for patients. And when we think about some of the things like health literacy or just like patient education more broadly, especially, particularly for this space where, you're kind of going through it for the first time and don't really know what you don't know. How do you kind of approach like patient education and really empowering expectant mothers to be, well informed and prepared for kind of all of these milestones for pregnancy and beyond?
Yeah, I think it's critical that we meet patients where they're at.
Mhm.
and are able to relate to them on a deeper level. As a physician, I really strive to kind of inform the patient, like what I'm thinking, what I'm looking for, why. And I ask them to write down questions because what we talk about is really overwhelming and daunting, as you had mentioned, Nina. And sometimes you don't process it all in that initial visit. So,
Mhm.
really encouraging my patients to become as engaged as possible in their health, helping them connect with one of our nurses in our clinic, and striving if there are barriers in communication. For instance, yesterday I had a patient who spoke Haitian Creole. Ensuring I had a
Oh.
Haitian Creole live interpreter with me to ensure there are no gaps in that communication and understanding, a patient's perspective based on her culture, based on any other aspects of her life that may influence her decision making. So I think getting to know a patient beyond the medical, but really delving into the psychosocial is really,
Mhm.
really important. And also encouraging patients to engage, ask questions. No question is silly or not important, and making sure you develop that trust with the patient that will allow her to ask those questions.
I love that. And I really like that you're kind of promoting like the empowerment, the advocacy, being able to ask questions and kind of have it seems like you really like take the time to create that space
Mhm.
for like conversation discussion. And I think that's so important. So I love that.
Thank
Um,
you.
I do realize that we're so close to time, so I wanted to end with one of my favorite questions to ask, which is, do you have any words of wisdom for us that you want to share, just as it relates to career advice or just broader advice, maybe anything that a mentor has shared with you that you want to share forward?
Yeah, I think staying true to yourself and what you kind of staying true to yourself and your passions. And I think that's really important, and that will really guide you in terms of kind of the next steps,
Mhm.
and believing in yourself. And oftentimes, when you find yourself, questioning, really relying on your mentors and not being afraid to collaborate and partner with others because there's so much work to do in this space that just like I think that there's so many opportunities that we can all work together to really create more timely care, more women-centric care, more equitable care. So as a clinician, I firmly believe like partnering with other clinicians is really important. So if you're in like the biotech space or industry, I think getting the perspectives of physicians is really, really important because we're kind of boots on the ground seeing the patients and can better
Mhm.
inform you all of problems. So, we're open. We are excited to engage in conversations and dialogue. So feel free to reach out if there are any questions. And thank you again, Nina.
Thank you so much. I love just kind of ending on the power of collaboration and community. And on that front, Dr. Aisha's LinkedIn and all that information is available in the chat if you do want to reach out for additional questions, want to pick your brain further. Make sure that you join us next week for our next Women's Health Tech Wednesdays. Wanted to thank you to our sponsors for sponsoring this incredible conversation. And one last shout out to our guest for such an incredible discussion. I so appreciate it. And we will see you all next Wednesday. Bye, everyone.